4 months after scientists reported a new strain of the mpox virus in the DRC, the Africa Centers for Disease Control and Prevention now says the mpox outbreak constitutes a public health emergency of continental concern.
With a heavy heart, but with an unyielding commitment to our people, to our African citizens, we declare mpox as public health emergency of continental security in Africa.
In recent weeks, health experts have expressed concern as the new and more deadly strain of the mpox virus spread from the DRC to 15 other countries. Burundi, Kenya, Rwanda and Uganda are among the countries that have reported mpox cases for the first time. According to Africa CDC data, there have been over 17,500 cases of infections of mpox and more than 500 deaths on the continent this year. Experts say this calls for regional solidarity in tackling the disease.
The information we have reflects only a partial situation of what's actually happening. So that means that even though the situation and the evidence we had showed that the problem was quite severe, it's in reality probably even more so given the limitations we have.
The declaration is a call to leaders to make resources available to help fight the outbreak. The continent's top public health body says Africa needs 10 million mpox vaccine doses, but currently has access to just 200,000.
Mpox is a global threat, a menace that knows no boundaries, no race, no creed. It is a virus that exploits our vulnerabilities, preying on our weakest point. And it is in this moment of vulnerability that we must find our greatest strength and demonstrate that we are all learning from the COVID lesson and we are playing solidarity.
The development comes ahead of a meeting by independent experts appointed by the World Health Organization to decide whether the mpox outbreak in Africa is a global public health emergency. The committee will advise the WHO Director General on what recommendations he should issue to manage the spread of the disease. Vulkisanyabwa, CGTN.
Let's get more perspective on this from the Democratic Republic of Congo. Chris Kasita joins us live via Zoom from the capital, Kinshasa. He is the head of Operation for Mpox Section at the DRC's Public Health Emergency Operation Center. Hi, Chris. Thank you so much for joining us on Africa Live. Chris, the DRC recorded a new strain of the Mpox virus about 4 months ago. What is the status of the outbreak currently?
Yes, the country has recorded 5,100 cases to date against 5,037 deaths. 20 provinces out of 25 have lost one confirmed cases on 24 out of 25 have reported and last one suspected cases. Therefore, it's the clad 1 that has and clad 1A and clad 1B. If it circulates in the country much more, particularly in South Kivu, in Equator, and in South Ubangi and Sankuru.
Could you please tell us, the mpox has now been declared a public health emergency on the continent. What does this mean and what sort of interventions are we looking at?
This means that the virus is circulating in different African countries with the fluidity of a population movement between the neighboring countries. This is quite normal. When the migratory flow is uncontrollable. It's therefore important to strengthen surveillance at the point of entry, even though it's difficult, but it's controllable.
So there are fears that mpox could spread across Africa. What should health authorities do to contain this outbreak effectively?
Yeah, it's been training exchange between the member states of neighbors to the international health regulation. All states that have notified deaths case will have to contribute effectively to strengthening surveillance, but also prevention and control measures for the infection. It's also important to consider vaccination across countries in the target population and strengthen the communication with community engagement. Therefore, with all these measures, we can stop this epidemic in our country, in our country, and in Africa, all country in Africa where it's nearly the cases of the virus.